So I'm Dr. Nina Bass, consultant clinical psychologist with the Integrated Co-Occurring Needs Pathway, ICoN.
Lovely stuff. So we do have a few questions for you this afternoon. So how would you explain the ICoN service to someone who had no previous knowledge of it?
Okay, so ICoN is the Integrated Co-Occurring Needs Pathway. So it's working with individuals who have co-occurring or existing together mental health and substance use needs. Often the individuals we work with also have other needs around housing or physical health difficulties or maybe offending, but predominantly we're working with individuals who have mental health and substance use needs. And as we know, they often occur together. Mm-hmm. So if we understand addiction or substance use as actually in terms of an individual's trauma and experiences and a way of coping, that's why we've created the team to come together. So it's a partnership between local mental health services, which is Midlands Partnership University Foundation Trust, and STARS, which is the Staffordshire Treatment and Recovery Service, which is linked to the Humankind charity.
Lovely stuff. Can you tell us about the Midlands Partnership NHS Foundation Trust and the work the organisation does?
Yes, so it's a mouthful, but MPUFT, as we now are, the University Trust, is local services across South Staffordshire and in other areas, but South Staffordshire providing mental health treatment care for individuals. It covers various areas, so adults, children and young people. We've also got learning disability. We've got forensic services, older adults, dementia services and various other services and specialist services providing mental health care and treatment for individuals. And obviously our core mission is around working together to build better lives for our communities. So it's around empowering and engaging our workforce. It's around bringing people together and having people at the heart of what we do. And then also thinking strategically about how to develop services for providing mental health locally. And obviously in terms of the community mental health transformation, it's been a national project in order to enable people to access mental health services. So we recognise that individuals might struggle at points to access services and that services might not always respond in the way that individuals may feel best supported. So the transformations enabled us to develop services, for example, like ICoN, recognising the large need of substance use within mental health services, as well as other needs around financial well-being, housing and social kind of needs as well. So,
okay. So how does that fit into the ICoN pathway?
So I suppose in terms of what I was just saying around the transformation, community mental health transformation, recognising that individuals with mental health needs may not always be able to access services as they've been currently set up. So individuals might be unable to, for example, attend appointments regularly. They may not be able to make full use of the interventions because of where they're at in their recovery journey or in terms of their substance use. And really trying to recognise that actually there needs to be a shift slightly in services to reach out to people. So that's where ICoN kind of really focuses in terms of trying to engage individuals, offer an opportunity for people to come and talk around their mental health and addiction, see those difficulties as co-occurring as together, and rather than being separate difficulties that need to be treated by separate services. So really what we're trying to do is transform the way people work together, really working with partners and partner organisations, recognising the quality and service availability within voluntary community and social enterprise, so services, charities, for example, like STARS and Humankind, where we can work alongside the NHS in providing kind of a holistic service for people.
Okay, so can you tell us a bit about the structure of the ICoN team? Yeah.
So there's a few of us. It's a small team because our focus is to enhance the provision that's already there within local services, rather than necessarily for people to have to only access ICoN. There may be some individuals who do, but ultimately we're trying to provide a kind of enhancement to local services. So we've got myself, who's the consultant clinical psychologist and clinical lead for the team. We've got a team lead. We've also got 2 other clinical psychologists who work across the whole of South Staffordshire. And then we've got 4 care coordinators or substance use workers that are hosted by STARS. And then what we also have is we have time from social care. So we have some identified individuals who provide some time into the service. And then we also are in the process of recruiting specialist kind of mental health practitioner roles in order to improve the links with local community mental health teams. So we really are bridging the gap to avoid people falling in that gap between services.
Wonderful stuff. So thank you so much, Nina. And I just hope you enjoy the rest of your day.
Thank you. It's been nice to meet you. You're excited.
And I'm with Emma Cormack from STARS in East Staffordshire. Hi, Emma.
Hi, Clara.
So, Emma, do you want to tell us a little bit about you?
So I'm a service manager within Humankind, STARS, working predominantly in East Staffordshire, but also been setting up the ICoN pathway, which we're here to talk about today, and have been really lucky to be appointed a service manager over the pathway and be able to see it build and grow to a point where we are now live and running actively as a service.
Wonderful. So quite an exciting event happening today. So is it important to build successful partnerships across mental health and substance use support services? And if so, why?
Yeah, I think undoubtedly. I think that, as I said, we've got a lot of people who, when you're in active addiction, there's often a mental health need, whether that be at a low level or, such as low level anxiety, low level depression, through to a variety of things, self-harming, through to kind of long-standing trauma, maybe back to childhood. And we know that people fall through gaps of services. We recognise that. We know that it's not productive for people often to keep repeating their story again and again. They can feel like they're not being heard, like they're not being understood. So what we really wanted to achieve within the ICoN partnership was to make sure that people weren't having to do that. So that's why integration was so important, in making sure that that person just has to come, tell their story once, and then they can receive all the support that they need in one place.
Okay, so how has the team at ICoN responded to any challenges?
I think that there have been challenges, definitely. It would be unfair to say that we haven't had challenges. But I think actually the team have been really, really resilient. We've been really lucky that we recruited quite quickly into all of our roles within the team. So the team have been able to form and bond, so that they've been able to build up quite a support network around each other. One of the important things when we were setting up the pathway was team wellbeing. We recognise that just as much as we need to look after our clients and support them, we need to support our staff. We can't give our best to the clients if we're not at our best. So wellbeing has been a huge part of the pathway. We have 2 hours a month where we have protected, allocated time to do some reflective practice and some things around wellbeing. And that's really supported the team in overcoming any challenges. It's built resilience and it's built them to be kind of a really strong team.
Okay, so what's been the biggest successes of the service so far?
I think successes definitely have been, we've recruited really quickly. We know that there's been gaps across the health and social care sector for quite a while now, since COVID. And actually we were really, really lucky that we had a lot of interest in our roles quite quickly. So we was able to form quite quickly, which meant at the point that we went live, we had a full staffing team. And that helped kind of overcome some of the challenges in terms of, we had a lot of interest. We had a lot of people put forward to come onto caseloads, a lot of people that were still in quite high level crisis. So being able to kind of have a full staffing team meant that we could take more people on because we had more space, we had more capacity to do that. So it's been really good to be able to go live with a full team.
Mm-hmm. Okay. And finally, Emma, so what have you found the most rewarding about your specific role within the partnership?
I think for me, although it's early days, I've started to see the success. And I think although when we talk about success traditionally within services, we talk about the person who's now alcohol-free or substance-free, they've got into recovery, they're doing really well, and that absolutely is a success. But within the ICoN project, we haven't quite got to that point yet because it's early days. But I think for me, I've seen positive improvements in people. I've heard people saying, you know, that they feel heard, they feel supported, they feel valued. We've seen people that traditionally would have DNA'd appointment after appointment, turning up to appointments. So I think for me, seeing the potential in those people and knowing that we now have something that can meet their needs has been absolutely the most rewarding thing by far.
Lovely stuff. Emma, thank you so much.
Thank
We'll
you.
leave it there. Thank you.
Thank you very, very much. First of all, can I say a huge thank you to you all for having us. So on behalf of Holly, who I think has already had to go, and Stephen and myself, thank you for inviting us. And we really had a fantastic day. And thank you for doing what I said in my report. I mean, what I tried to do when I wrote that report was put the drug-dependent person at the centre and then say what you have to put around them to give them a chance of making a good recovery. And I did put a lot of things around my person, but essential to it was mental health and trauma. That was really the biggest thing that I thought if we couldn't do that, then we can't actually turn this tanker around. And what I always say is, I'm a rheumatologist by training, and if I had a patient with rheumatoid arthritis and breast cancer, I'd never say to that person, well, when your rheumatoid's under control, I'll look after your breast cancer. You know, you would be before the General Medical Council if you took such a terrible approach. You would treat both things together. And the idea, I have no idea where it came from. I can't imagine why anybody in the past 30, 40 years has decided that you could say to someone with an addiction problem, when you deal with that, I'll deal with your mental health. It is to me immoral. It's as simple as that. It should be stopped. And here you are doing the right thing. So, I mean, that is just wonderful news for me. I've talked to lots of treatment providers and to mental health trusts, and they try to educate me and tell me they do it separately. And, you know, you have to be referred. Well, I don't think that's the way to do it. And it's got to be brought together by some means or other so that the person and their needs are looked after. And I know that eventually you will try and also bring into that social care. And so there's some of the really key elements of integration and really making it a person-centred approach. I do beg you to keep your data, because what you need to be able to do is to show this to the rest of the country. Because if you can make it work, then you will have shown that what's been going on for all these years shouldn't have been going on, and it should be an integrated service within, for me, that whole journey of recovery, because this is about someone going at their own speed along a journey of recovery. And the idea that you may relapse is also real. I mean, we have to be realistic. It's a chronic condition. But what you need is to be able to get help very quickly. So I love the idea that you're going to have follow-up. And I think you need some means of how does a person, even 18 months out, be able to come and have the right telephone number to actually come back and get help quickly. Because, you know, if a diabetic patient runs out of control, you don't wait until they've had a hyper event before you start looking after them. You do it immediately and quickly and give them help. But that requires us thinking about addiction as a chronic condition that really we should treat as we do every other health condition. So it has been quite fantastic. I do believe you could be a catalyst for change around the country. I think the fact that you can be flexible and fluid is extremely important, because this lack of flexibility, when I first started work, the consultant psychiatrist used to say to me, no, Carol, we don't do addiction. And the addiction psychiatrist said to me, well, you know, Carol, we can't treat mental health problems. I didn't quite understand it. They both belong to the College of Psychiatrists. So I thought, well, this doesn't actually make sense. And so the idea that if you're in an addiction, if you are treating addiction, you ought to be able to treat mild mental health. And if you're on the mental health side, you ought to learn enough about addiction to be of use. So I just think that it's been a really wonderful thing to me that I've been able to come today and see you doing what I've so hoped that somebody around the country would do. So I can go back and say there is somewhere, and if only you want to learn how to do it, you go to Stafford, because I've not really had anywhere where I could say they have genuinely put together their mental health services and their addiction services, and they understand what the journey. I know it's been difficult, and I'm sure that there's been a lot of learning, but I hope you'll invite me back in a year or so I can see where you've got to. And we, of course, will fight as hard as we can to get some more resources. And do think that, you know, in a year we have to put in for the next spending review. I mean, it'll be, I suppose, about a year, if not perhaps a little bit more. But if you have got good data, and we can show to the Treasury that if you do things differently and you innovate, then you can start to bring about change. And it doesn't have to be massive change. It has to be a journey that's being travelled. And, you know, just like I'm trying when I go around the country to say to treatment providers, please could you just count the number of people who go into positive recovery? Because we don't collect that data. So how do I know whether someone has been in treatment and has finished treatment? Who tells me, or the government, whether they're now in what I'll call a good recovery programme? I don't know many places that count that. And yet it's a simple thing to count. And so I think it's building up that data and the evidence that will allow us to say this isn't an impossible task, as people have said to me, and you can't do it. You could show us that we could do it. So, Tony, thank you very much for getting us here. I know it's taken some time, but it's been a wonderful experience for me and for Stephen and Holly, and we shall go back very happy.
How does the ICoN pathway align with any of the recommendations within your review on drugs?
Well, they're just bang on target, because what I said was that the drug-dependent person has lots of needs that are essential, but the most critical need that I could see was support for their mental health and the trauma they might have experienced as a child or as an adult. And then if you don't address that, they won't be able to give up the substance they're taking. And then often they're leading chaotic lives, because that's what an addiction does to you. So you need to support people in a social care way. So it is just really, I couldn't ask for more.
Lovely stuff. Thank you so much. And thank you so much for joining us today. Thank you.